today's topic we're having patient's autonomy. Is patients always right? So I believe that we all heard the phrase, the customers is always right, which suggests that the customers always come first. But how does this work in medical field? Is the patients always right? Well, there should be a few sectors we should dive in before we come into a conclusion. Today, we proudly have Dr. Ding from the Department of Microbiology and Immunology of UKM on board to help us to resolve our concerns. A round of applause. Yay! Okay, so the first question is, Dr. Ding, how would you define autonomy?
Autonomy, as I believe, refers to the right of somebody to choose, regardless of whether the answer or the choice is correct, but it's your own personal choice. And for patients, it translates to their right to request for specific treatments, medications, or procedures.
In that case, what do you think about the phrase, the patient is always right in the context of healthcare?
Well, patients are right to some extent, for example, because they have the right to request for specific treatments or their preferred treatment, and even the right to choose which specialist or which doctor they would like to see. However, when it comes to ultimately receiving the care or the treatment that they want, they might have to defer to the opinions of the experts. So the patient is right to some extent, but not all the way. Yeah.
So that means that the patients would always have the rights to choose some treatment or like some medications or some specialists even, but they don't have fully access on the control of the medications that they want, is it?
Like for example, they might say, because some conditions can be treated either medically or surgically. So if that was the case, then the patient would say, okay, I do not want surgical treatment. I want to go for the medication based. For example, if there's a prostate enlargement, you can either do a prostatectomy or a TURP, or you can just take some medications, alpha blockers. So you got the conventional versus the surgical. So the patient has a right to choose. I want the conventional, not the surgical. I want the medical, not the surgical. But the expert or the specialist will ultimately have to weigh the pros and cons of the patient's choice.
So the patients have to know the pros and cons before the patients get to choose the choices, is it?
Yeah, but from the situation in Malaysia and even around the world, many patients who come to see the doctor, they already have some kind of concept from Wikipedia and I guess ChatGPT.
Yes.
So they would come to the doctor with already the treatment that they want, and they'll say, okay, I want this drug A or I want this procedure B. So that is their right, fine. You can tell us your preferred treatment. We have to judge and whether it is suitable and whether it does more harm or any other thing.
Okay, so the second question for you, Dr. Ding, can you please share an experience from your previous work where you had to handle a situations where a patient insisted on something that may have not been the best course of actions? How did you handle it?
Okay. As they say, strength in numbers. So I used to work in the emergency department. That was like more than 10 years ago. And one patient came to the emergency department with an unusual request. She claimed she had some headaches or some vague symptoms and wanted a CT brain done on her. So I told her it's not CT brain and also MRI. She wanted a lot of investigations to be done on her. But after examining her clinically, there was no indication for even a CT brain, let alone an MRI. But the patient was quite adamant. She didn't want to give in so easily. Kept on saying this vague symptom that she had is a great cause of distress. But she seemed perfectly fine actually. And she was actually assigned to the green zone. In the emergency department, we have the various zones, right? Red, yellow, and green. So the green zones are for the very stable patients. So after examining her and assessing her clinically, there was no need for even a CT brain. But she was so insistent on it. So the best way to handle it is I had to get in my colleague. So we have colleagues in the emergency department. So with another colleague, we talk to the patient. You know, the CT brain actually might even do more harm to her. As some people would have known, you know, one CT brain is equivalent to 100 X-rays.
Yeah.
Yeah, it's very high radiation.
Yes.
So you don't simply order a CT brain unless you are. There's really indicated. There's really some reason to do it. Based on our assessment, there was no need. She was fine. She was neurologically was normal. Didn't have any history of trauma or anything that would likely suggest that the need, or even any space-occupying lesion, you know, like headaches with vomiting and things we suspect a neoplasm in the brain or things like that. No, it's very nervous and then demanding. So yeah, you need another colleague to help you to convince the patient. Sometimes strength, like I say, strength in numbers.
So at the end,
you need to get your colleagues to help you. Yeah, to talk together. You counsel the patient. The more people talk to the patient, it actually, you know, to me, it worked lah. And then the patient left after that.
So she didn't get
She didn't get what she wanted because, in our opinion, it was really not justified.
But did she know that actually a CT scan harm more?
Okay, I'm not trying to say that do not do CT scan. Okay, if the need is there, yes, it is important.
Yes, yeah, I understand.
You do need to diagnose a lot of things. Like example, even brain tumor also, they say you need to do with contrast, or you need to do MRI. But you know, in emergency situation, yeah, the CT brain is important to rule out like bleeding, strokes. So, of course, if the need is there, you have to do it. But we do not do it for fun, because, you know, like I said, then the risk may actually outweigh the benefit, and the risk is the radiation is high.
Yeah. Okay. So from this, we can tell that we should always stand at the perspective of the patients to think something before we can let the patients to decide what they wanted without really having the strong evidence of their course of actions, is it?
Yeah, we try to understand why she requested this specific test, but it's not convincing for us to proceed with the request. In fact, patients that request for specific tests, we need to be cautious of them, you know, because they might be something they're not telling us.
Yeah, exactly.
Usually the doctor will decide, okay, you need this X-ray, you need this MRI or CT brain. The doctors will decide, but the patient came with a specific request. She wanted CT MRI.
Doctor, how would you address a scenario where a patient's request for specific medications or treatment conflicts with your knowledge of their medical history or potentially contraindications?
Okay, this can happen because of the patient is exposed to social media, Wikipedia, YouTube, and whatever else.
ChatGPT.
But the patients, they do not know the full picture. Every treatment given actually has a potential risk or side effect. Even a very common drug called paracetamol or M.I.N.O.R also has side effects if you take it wrongly. So what about other things which are not over the counter? Okay, I give you a good example based on my area of expertise, which is microbiology. So vaccinations come in two general forms: live vaccines versus the killed on inactivated vaccines. The live vaccines contain viruses, for example, which are weakened. But having said that, a weak virus can still cause infection if the person that received the vaccine is immunocompromised. And pregnancy has a risk of having the fetus being infected by the virus. Okay, and the fetus, as you know, the immunity is poor.
Yes.
It's not developed. Now, even a weak virus could easily cause infection in the fetus and affect its development, right? Causing congenital infection. Let's say a patient came and say, "Oh, I want a vaccine for chickenpox. I want a vaccine for rubella." You know, but the vaccines that are available in the market are only the live attenuated for this infection. So the patient we have to tell the patient, well, you know, you can get vaccinated, you can receive the treatment you want until you have delivered safely. Yeah, not during pregnancy, because we do not want harm the fetus. So maybe explain the potential side effect, the risk. Patients would understand. It's better if you can provide pamphlets, you know, some material that helps a lot. Yeah, some clinics, they have a lot of these pamphlets printed by the drug companies. So you just hand them to them, let them read. Yeah. So after you explain, they read, they understand better.
So the main thing here is that we have to let our patients know any consequences of their course of actions to let them like redeem their decision.
Yeah.
So that it do no harm to either the mother and or the fetus.
Yes.
Yeah, okay, understand. Now, doctor, can you please discuss a time where you have to communicate effectively with a patient to manage their expectations, especially their request or like expectation is not really feasible or in their best interest?
Communication, as you know, Malaysia is a multiracial country, so we would have to deal with patients who may not speak the same language as you do. Therefore, communicate effectively with anybody, you have to get through to them in a language that they understand very well. So for Malaysians, like for example, if I'm a Chinese, if I have to deal with an Indian patient, to communicate effectively, of course, we can use Bahasa, but even better would be if you can get a translator to explain in the language that the patient is most familiar with. Yeah, so we have many medical students around from all sorts of races. That is one way we get the student also will learn something. So they will learn about how certain diseases are explained, and they help us to across to the patient effectively. Yeah, speak in a language that you understand. That is what I would advise now. And in fact, there are also many Chinese like myself. I don't speak Chinese very well. Literally, what they call a banana.
Oh.
So of course, if that was the situation, there's no shame in getting another colleague who can speak Chinese or even dialect. Yeah, to get across to the patient, and they appreciate the gesture definitely because they can also ask questions more freely. The answer also is something that they can understand. That's what I will do.
So when I bring my grandmother to the hospital, and the nurse is an Indian, and she's talking Cantonese to my grandmother.
Indian, talk Cantonese? Wow.
Yeah.
Impressive.
And my grandmother was like very, very happy. She's like, oh my gosh, she can speak Cantonese. So so in this case you can tell that language being the main barrier for many of cases.
Yeah. That's also the source of miscommunication and also misunderstanding.
Yeah.
So very important. What you say, patient really has to understand. So what better way to say that in a language that means that the person knows?
So I think it's almost the end of the interview. But before we end the interview, doctor, could you please give a conclusion or a summarize on the topic that we discussed?
The questions that you ask are actually relevant from the medical point of view. And I believe many doctors will start facing them even as housemen already.
Yeah.
You would have to know how to deal with it, and hope that whatever it is, always ask for help. Don't be a hero. If you're not sure, ask a senior, ask a specialist. We don't train you to be heroes. We train you to know when to ask for help. Actually, I think that is the main goal of a houseman. We don't expect you to know everything, certainly, right?
Yeah.
So we expect you actually to ask. That's why you're put under like some consultant or specialist who will be in charge of housemanship. Yeah, you don't do things on your own. Unless it's a very simple procedure that you are very sure. If it's something that is new and you have never experienced or encountered before, you really have to seek guidance.
Okay, I think this sums up the interview of the day. So thank you so much, Dr. Ding, for this interview.